Good day and welcome to the first episode of ALAB Radio Trip to the Future. I am Rupert and today we will be taking a dive into a very integral part of public health. In fact, some would say this field is the cornerstone of the public health practice. So buckle up and ready yourselves as we explore the field of epidemiology and biostatistics. From gathering, organizing, interpreting, and reporting data, this field uses a variety of statistical and research methods to make sense of multiple information, describe the pattern and distribution of determinants of health, as well as determine the cause of diseases and outbreaks. But it doesn't stop there because epidemiology is also concerned with applying the results of the studies to control morbidity and mortality. Today, we are honored to be joined by an esteemed faculty of the Department of Epidemiology and Biostatistics in the College of Public Health, UP Manila. Please welcome Professor 𝗘𝗽𝗶𝗀𝗟𝗀𝗏, Master of Public Health, Master of Science in Public Health Biostatistics. Hi, ma'am. We are thrilled to have you with us on this week's episode. Thank you so much for making time for us. I know you just came from a meeting. Thank you for really being with us today and be of inspiration to our listeners. But since not all our viewers are from CPH and they may not be that familiar with you po, can you tell us a little bit about yourself?
Okay, the pleasure is mine, and I'm really happy that you gave me the opportunity to share some of my experiences as a BS Public Health alumni and a part of the College of Public Health. Well, as I'm a faculty member of the Department of Epidemiology and Biostatistics, I am also one of the alumni of this college. I graduated the BSPH in 2009. So from there, you can probably compute my age. Please don't. And I also took Master of Public Health, and currently, actually, I'm still taking my degree in MSPH, major in Biostat. So there, very brief introduction about myself.
Thank you, ma'am. So we look through your CV po, ma'am, and it's impressive, I must say. Aside from being an assistant professor, you've worked with a number of agencies for various projects, including helping in the COVID-19 response. You're also currently the lead consultant for the Better Health program by British Embassy Manila. With such an amazing track record, can you tell us your journey? How did you end up, or what made you want to pursue a career in epidemiology and biostatistics?
Okay. Actually, I am not the lead consultant for the British Health program of the British Embassy in Manila. I'm just part of the team of consultants for the project. But just to share some part of my journey, well, just like everyone who are taking BSPH, I took the course because it is being packaged as one of the best, if not the best, pre-med course. But when I took my major courses, I really fell in love with public health. And I realized that I want to contribute in making policies that will really enable the people to take control over their health. But at the same time, I know that I am a person who likes very systematic things. I don't like gray areas or undefined areas. That's why I decided to pursue something that's more quantitative. And here I am at the Department of Epidemiology and Biostatistics.
Wow, it really suits your personality, ma'am, no? Taking that track, that career path. One should also really consider one's personality, what they want to pursue in their life. You also mentioned about being a BSPH graduate, right, ma'am? So a follow-up question I would want to ask, how did the college or how did the program under the College of Public Health and the UP Manila environment in general shape you into becoming the professional that you are right now?
Well, first of all, before I entered college, just like everyone, when I think about health, I think of it as merely the absence of sickness. But when I entered the College of Public Health, one of the first things that I learned is that it is a means to development. And there are really various factors that will help us that will really influence the health status. It just not does not just mean the absence of illness. Your lifestyle, your environment influences your health. Even education influences it. It's not just the absence of sickness. That's the first thing that really shaped who I am now as a public health professional. Second, I think this college really became, or yeah, CPH really gave me my passport to to success. It opened a lot of opportunities for me to really know or determine where I'm good at. As we all know, when we say public health, we have nutrition, epidemiology and biostatistics, microbiology, parasitology, environmental and occupational health, health promotion, health policy, and administration. The curriculum really helped us in determining where we are good at through its laboratory exercises, through the community work, the actual research experience when we took our special studies.
Yes, ma'am. Indeed, the college will really prepare us into becoming pro-people professionals in the future, knowing that really there are a lot of factors in order for us to consider the health of a certain population, the health of the Filipino people in general. You've also mentioned, ma'am, the different fields of public health. Actually, to our listeners, those are the fields of public health that we will be tackling in the future episodes. But going back to biostatistics and epidemiology, can you describe to us your experience working in this field? Like, what specific job or roles have you taken, and how was the experience?
Actually, when the first job that I took was not really related to epidemiology and biostatistics. Of course, it uses the tools that I learned from biostatistics, some of the things that I learned in epidemiology, especially disease prevention and control. But my first job was something that's related to more to health promotion and health administration. Well, I signed up as one of the 5 persons under the Public Health Managers Placement Program of DOH. The work entailed a lot of planning and tailor-fitting the disease prevention and control strategies to the needs of the community. After that, I moved back to Manila, and that's when I had the opportunity to be trained on monitoring and evaluation and program implementation by no other than Professor 𝗫𝗏𝗏, who was also a faculty member of the department. I also worked as a research assistant on various projects like antimicrobial resistance and tuberculosis. It was pretty diverse, but most of the tasks that were given to me are about creating and managing databases, collecting data, and synthesizing evidences. So I guess that part really helped me to think about things about data in a very systematic way. And that's why I decided to pursue Biostat and or EPI.
Wonderful. Thank you, ma'am, for sharing that to us. Now, given that you've been exposed to these experiences, you've gone out of the 4 corners of classroom of the CPH of the College of Public Health in venturing in these experiences. I'm sure you've witnessed some of the challenges, you've witnessed some struggles being in this field, going through these experiences. So my question would be, what are the challenges in epidemiology and biostatistics, or what are the challenges you've faced while being someone who is tasked to analyze data in those researches?
Okay. Well, epidemiologists and biostatisticians, I think, remain to be rare breeds. This is both an opportunity and a challenge for us. Number one, it is an opportunity because it helps us really book more jobs, because we are, again, rare. There are really very few people who specialize in the field. But if you are someone who really wants to grow and you see the need to hone your skills, then you'll have a difficult time finding a mentor. I experienced that when I was just starting in the field. Also, I think this pandemic showed us the importance of biostatistics and epidemiology in disease prevention and control. I mean, now more than ever. And the limited number of experts in the field who are, and most of them are actually staying in the urbanized areas, just like Metro Manila, it really pose a challenge in terms of controlling the spread of COVID-19 or SARS-CoV-2 in the other parts of the country. So I think this is a challenge for as a professional, and a challenge as a discipline, because there is really a limited number of experts in the field. Also, there are challenges in terms of or there are challenges in the field of research. We know that that research is one of the forte of a biostatistician or an epidemiologist. We are really good in handling quantitative research. Unfortunately, we are in a resource-limited country, and this is a challenge for us. So we really have to be resourceful in collaborating with other agencies or with other countries if we want to pursue research as biostatisticians and as epidemiologists. I also think that the social media can be a double-edged sword for us. I mean, it provides us an avenue to help or to educate people, more people, but it is also something that can be used in spreading false information. We can see now the effect of false information about the vaccine, incorrect data about COVID-19. And come to think of it, there may be people out there who just took some basic course on biostatistics or epidemiology, and who can probably give or who can probably talk credibly about data, and overnight they can become the biostatisticians or epidemiologists through social networking sites. So I guess that's one of the challenge in the field. Another thing, the field of data science is growing tremendously over the past years. There is also the danger that we produce data that are not really sound theoretically. So I guess a challenge as a discipline is that we have to marry data science and biostatistics and epidemiology at some point.
Thank you so much, ma'am, for giving us a very comprehensive answer about challenges in the field of epidemiology and biostatistics. Actually, I like it that you said, ma'am, that epidemiologists and biostatisticians are rare breed, because indeed, even me, I could see that there are a few people who specializes in this field. And also, this pandemic really revealed the need for more of these professions, because pandemic is a whole new level of problem. It really reaches it reveals the frailty of our system in general. No, and so we need data science. You've mentioned that we need someone who would give us credible data, who would interpret these data really well, so that the public would be able to be informed well, and as well as the government to also be able to use this data well in implementing policies, in implementing restrictions about COVID-19, about pandemic, and even about other diseases like non-communicable diseases. Thank you so much, ma'am, for really giving those pack of information about the challenges. Now, given these challenges, I'm sure, like what other people say, challenges actually gives us opportunity for growth. In fact, it gives us a lot of opportunities. Now, going from challenges, we go now to the different opportunities that we can take given these challenges. What are the career opportunities are there for BS Public Health students or anyone else interested for that matter in this field? Like, can you give us sectors, departments, companies, and respective positions that graduates can pursue in this area?
Okay. Well, all I can say is that the beauty of biostatistics and epidemiology lies in its versatility. I mean, since we are specializing in methods, we can collaborate with experts from a wide array of field, and you can work in a variety of settings, including the academe, biotechnology industry, pharmaceutical companies, healthcare settings, research and statistical consulting firms, and many more, because usually we are the ones who provide the quantitative evidence for the policies or for changes in patient care, regardless whether you are, for example, taking medical laboratory science or population health track. Those are the two tracks that be under the curriculum of the SPH, right? You'll be able to work or find opportunities. In terms of the need or the demand from various sectors, well, as you can see, the government agencies need us now. There are also a lot of non-government organizations, especially the ones who are providing technical assistance to, for example, Department of Health, Department of Interior and Local Government, who really need people who cannot just crunch numbers, but who can interpret them based on the realities in terms of disease prevention and control.
Thank you, ma'am. You've mentioned about the tracking that is being that is newly implemented for the program under the program of VS Public Health. So these are medical laboratory sciences track, and we also have the population health track. Now, for our listeners who don't know these two tracking new BSPH program, professional tracking for students, medical laboratory science is a track that specifies more on the laboratory techniques needed for nutrition, parasitology, and medical microbiology. Well, on the other hand, population health track focus more on the different fields, other fields of public health, specifically the occupational health and environmental health, the health policy and administration, health education, health promotion and education, and of course, epidemiology and biostatistics. Now, you've mentioned, ma'am, that epidemiology and biostatistics really is a versatile field, that it can be incorporated to all these departments or all these field of public health. Now, it's very interesting, actually, ma'am, to know what are the opportunities that can differ specifically for those who graduate from medical laboratory sciences or population health track. Or I think a more well-packed question for this one is, would there still be an opportunity for MLS track graduate in the field of epidemiology and biostatistics, knowing that this field is more focused or given focused in population health
Okay.
track?
I don't think there is a need for people who took the medical laboratory science track to be really worried if someday they find themselves wanting to be experts in the field of biostatistics. As I have said, the application of biostatistics has now expanded from public health and the medicine to various fields. For example, pharmaceutical industry, genetics. Though when you perform, for example, research in the clinical setting, for example, clinical trials, you need people who can do the lab work. Of course, if you are a medical laboratory scientist, you will be one of the people who should know how to conduct experimental study designs, right? Or experiments. Now, that background will help you in determining the realistic way of gathering and analyzing data at the laboratory setting. If you're there are a lot of biostatisticians actually who work in laboratory or in work on experimental studies. So I guess if you are taking the medical laboratory science track, there is still a good opportunity for you to use your laboratory skills and bridge that to the research design and data analysis.
Thank you so much, ma'am, for assuring us that the tracking would not really matter much when it comes to really pursuing a career path in epidemiology and biostatistics. Now that you've mentioned these opportunities, that there are a lot of opportunities that await for us, even if we are graduates from MLS or we are graduates from population health track. I want to ask, ma'am, specifically, what are the set of talents that can make or break a career in your area? Like, can you describe to us the type of person or set of skills that you think would fit in well to this industry?
I don't think there is a hard and fast rule in terms of determining or whether you need or whether you will do well in the field someday. But based on my experience, I really think that, training yourself to work in a more organized, step-by-step, systematic way will help you become successful in the field. I mean, as I have said a while ago, I like Biostat and Epi because everything is defined. If not everything, almost all of the things that you will be handling should be defined. And you need to be trained to follow steps if you want to become an expert in the field. If you are good in math, well, you have an advantage, especially if you will decide to work in the field of academe. But if you want to, for example, take the path of research or something that's more applied, then even if you're not the best student in mathematics, then you can still do well in the field. So there.
Thank you, ma'am, for telling us that the things that we need to consider in order for us to practice this field, specifically biostatistics and epidemiology. Now let's go into a topic which I know a lot of listeners are interested in. I know that if we are encouraged to choose a career track that gives us fulfillment and a sense of service to our country, ma'am, which I think is very evident in your story. But we can't deny that salary is a big part of that decision. I mean, specifically for me, ma'am, especially for the students out there who are breadwinners of their family. So can you give us an idea on the financial aspects of working in epidemiology and biostatistics? Like, what's the usual entry-level job, or are there grants given for those who want to pursue research? And is it recommended to already have experience first? Basically, the more practical details of working in the field.
Tricky question if you are asking about remunerations. Well, I guess all I can say is that there are really so many opportunities, and jobs pay well. Believe me, but you really have to gain experience first and to study epidemiology, or take a course on epidemiology and or biostatistics before you can get the lucrative job offers. If you are thinking about a first job, I and you want to specialize in epidemiology and biostatistics someday, I suggest you try to find something that's related to quantitative research. You can also try, look for jobs about that are related to monitoring and evaluation. I know some of you might think that it's a bit odd because you usually hear monitoring and evaluation in your health policy and administration classes, but actually your quantitative skills are really important when you do monitoring and evaluation. Your skills in developing databases, collection tools, summarizing data are really important if you will go into that kind of jobs. So I guess that's a good stepping stone for someone who wants to pursue epidemiology and biostatistics someday. Of course, you can also try working as data collectors, data managers.
Yes, ma'am. I think it's not that much of a difficult time for people who want to build their credibility since, as you've mentioned a while ago, epidemiology and biostatistics really offers a lot of opportunities where students may try in the future. And through that opportunities, through that different ventures, different aspects that we can try, we know we'll be able to learn a lot. We'll be able to practice our proficiency and then be able to find a lucrative job afterwards. Thank you so much for that, ma'am. Now let's go to, I think, a more personal question, but I think also essential that our listeners and viewers would be able to know about something that you may wish to have done differently in your professional journey. Like this can be anything, a decision you wish you did differently, a thing you wish you could have done earlier or later, a mistake that you made, just anything really that you want to give a prompt to our aspiring biostatistician and epidemiologist.
If you're asking about any regrets or things that I could have changed, well, I honestly think that I have no regrets about pursuing the career. And if I will be given the chance to redo my career journey over again, I'll still do the same things. I mean, it took me almost 6 years before I was able to find a stable and permanent job. But I guess that's what really makes the journey worthwhile. I mean, as I have said, I worked on various projects. I found myself starting on projects, and then the next thing I know, I'm already on the hunt for my next job. But those things really helped me find where I'm good at. It really helped me also improve my communication and collaboration skills. And you really need those skills if you want to pursue biostat or epi someday. As I have said, we are the methods expert. We have to really collaborate with the content experts, so from various fields someday. There are also Well, I have to admit there may be times when I am thinking that I should have pursued my PhD earlier, but if I have done that, then I wouldn't have the opportunity to work on the COVID-19 projects that I am currently involved with now. Those things, I think the delay really also contributed in developing my leadership skills and my skills in working as part of the team, of a team.
Yes, ma'am. Truly, the joy of this field is within the process of being in that field, of testing the water first, and then being able to set sail after you have a feeling of after you being able to immerse yourself in this field. And I like it also, ma'am, that you said that really no regrets for being in this path because we learn from these experiences, and these learning are valuable. They are unparalleled for us to become a more effective professional under this field. Just to end this interview, ma'am, just very briefly, what advice would you give to people aspiring to excel in your field? I know you've already mentioned some of them, but just in case you have a final say about this field, anything that you want our viewers, listeners to know, yes.
Okay. Well, patience is a virtue. You may think it sounds cliche, but patience is really important if you want to pursue epidemiology and biostatistics. Right after graduation, you cannot be considered an expert in the field, right? You have to gain enough experience first, and you have to study again. I mean, you really have to have a healthy balance of the experience and the theoretical knowledge about disease prevention and control, and the determinants of disease if you are going to pursue epidemiology, or the statistical theories if you want to be a biostatistician someday. It really takes a lot of work, and you have to be patient. And as I have just said earlier, you really have to train yourself how to be more organized, to think in a very systematic way, because again, as you know, when we say methods, there is a really defined way of doing things, and you have to follow it step by step and follow it by heart. So those are my advice for people, the younger ones who would like to pursue the field someday.
Indeed, ma'am, patience is a virtue. Thank you so much, ma'am. That's a wrap for this interview. Again, thank you so much, Ma'am Latorre, for giving us your time and sharing with us your knowledge on the career opportunities in epidemiology and biostatistics. We really learned a lot from this experience and your experiences. And dear listeners, I'm sure you'll learn a lot more in another field that we'll discuss in the next episode. This is Rupert for ALAB Radio. Till next time, may you continue to seek your fire within.
ALAB Radio Trip to the Future is an initiative by ALAB College of Public Health in coordination with UP Manila CPH Student Council and UP Hygiene Society. This program is in partnership with ISEC, University of the Philippines, Manila, Alliance of Public Health Athletes, 𝗘𝗵𝗆, Public Health Artists Circle, Progressive and Responsive Organization of Pharmacy, Industrial Pharmacy Honor Society UPCP, 𝗘𝗵𝗹𝗶, Staff CPH, in cooperation with UP Biology Majors Association, UP Manila Classical Ensemble, UPM Peer Empowering Peer Society, together with our media partners, SparkUp and WhenInManila.com.